each and every one of you, and in particular we welcome this morning and our colleagues from the WHO who are also a member of the forum this morning, as well as a representative to our opening stakeholder consultation meeting for the ANSO.
The Honourable Minister for Health and Medical Services, Dr. Ifiremi, the Acting Head of the Division of Pacific Technical Support, WHO Suva Office, Dr. Kim Ali. I understand members of the Harvard Medical School Global Surgery Division and the Royal Australasian College of Surgeons connected with us virtually for the meeting. Staff of the Health Ministry from all health divisions in Fiji. To our invited guests, ladies and gentlemen, Bula Binaka, and very good morning to you all. Ladies and gentlemen, I'm pleased to be here to open this important consultation workshop for the development of the first ever National Surgical Obstetrics and Anesthesia plan for Fiji, because improving access to surgeries that can save lives and improve the quality of life for Fijians is one of the most important things we can do in our healthcare system. I'm particularly pleased that this two-day forum is not just a discussion among health professionals, but includes the people who use health services. So I understand today we bring together health staff from all divisions of Fiji, but tomorrow we will have a full dialogue with representatives of the wider community. The community perspective on how health services should be delivered in Fiji over the next 5 years will be critical to good planning, of course, the wise use of resources, and eventually to sound execution. The need to develop a national surgical obstetric and anesthesia plan for Fiji has risen from the global recognition that there's a huge unmet need for surgical care throughout the world. Every year, more than 313 million surgical procedures are performed globally for illnesses, for accidents, and common conditions across the medical spectrum. But only 6% of these procedures occur in the poorest countries, where over a third of the world's population lives. Our record in Fiji, I understand, is a little bit better, but our goal is to be on a par with the most developed countries. Our people, of course, deserve no less. Human life and quality of life are in the balance. The World Health Organization estimates that an additional 143 million surgical procedures are needed in low and middle income countries each year to save lives and prevent disability for surgically treatable diseases. The World Health Assembly has taken this on as a priority. It has called on member states to identify and prioritize a core set of emergency and essential surgical care that should be made available both at the primary level and at the hospital of first referral. It has also called on member states to strive for universal access to safe and quality emergency surgical and trauma care for all, without financial hardship. Fiji embraces this goal, of course, but I can tell you that Fiji did not need any prodding to do this, to make this a priority. Our infrastructure to deliver this kind of care is better than in most developing countries, but we want to improve it. A survey conducted in 2017 revealed that 67% of our population can access specialist surgical care within 2 hours of their homes, that we have 5.4 surgeons and surgical support personnel per 100,000 people, and our mortality rate related to surgery was 0.8%. I expect that these indicators have improved over the last 4 years, given the Health Ministry's greater focus on specialist training for doctors and other health professionals, and of course the increased effort on outreach services. Over the next 2 days, ladies and gentlemen of this forum, you will focus on the need to consolidate what we have achieved and to keep improving. And as you know, this meeting comes as the first doses of the COVID-19 vaccine have arrived in the country. Now, although the pandemic bears no direct relationship to the subject you are discussing, the fact that we are about to begin vaccinating reminds us that healthcare is a joint responsibility. I'm not biased, but I sort of recognize and notice that the first 2 Fijians that were given the vaccine yesterday were both from Teleu. Ladies and gentlemen, government health professionals and the community work together to make Fiji healthy. We began vaccinating yesterday, targeting, of course, 6,000 frontline individuals. That is our first step on the road to national recovery. And I appeal to all Fijians to support the health ministry as we roll out the vaccination program for COVID-19. Your government is committed to vaccinate all eligible candidates who are 18 years and over, according to the ministry's expert advice, as soon as is physically possible. These vaccines work, they are safe, and they are the key to our economic recovery. I would like to thank WHO once again and the COVAX facility for providing those first 12,000 doses of vaccine. And we look forward to receiving the rest of vaccines under this arrangement soon. This vaccine is part of the arsenal of public health measures that we have employed to date, that we are relying on to protect our people and prepare our nation to re-engage with the rest of the world and reclaim the position in global affairs we worked so hard to achieve. I know Fijians are keen to register and be vaccinated. We are working on procuring all of the safe and effective COVID-19 vaccines. We need to see that our people are immunized alongside the citizens of developed nations. We will not allow ourselves to be left behind. Over these next 2 days, ladies and gentlemen, you will plan for the future of surgical care and healthcare services for the nation. Healthcare, you understand and we all know, is a critical service. Providing health services and a healthy environment is a key to a wealthy and economically productive nation. It is a moral responsibility, and it is one of the first duties any government owes to its people, along with security and education. Please make the most of this opportunity, make the best use of the technical expertise at hand, listen to the voice of the community, and put together a plan that will serve our people well and help our nation grow and prosper. My best wishes for a fruitful forum, and I'm happy to declare the consultation forum open. And God bless you.